as well. I'm going to leave the chat up as much as I can. Feel free to interject. I'm going to leave the chat up because I know sometimes people don't want to answer or ask anything, in the middle of the presentation, but feel free to put something in the chat or just interject during this presentation. It's meant to be interactive. I want to make sure I address all your questions. I may get to your question on the next page and I'll let you know that, but again, feel free to just, shout out and ask questions as you need to. You might have questions after you hang up. We all hang up, and that's fine as well. I'm going to give you our contact information to be able to, check in with us and ask any questions you need to. We have 4 people on the team who are ready to address your needs this week. Okay, so I'm going to get started. This is obviously your open enrollment, 2020 benefits open enrollment for Miller Brothers Staffing. Open enrollment started yesterday, September 8th. I know it's a short window. We have the 8th to the 11th, Tuesday to Friday. If we need to extend that a day, we can certainly do so because we know we're coming off that holiday weekend. But let's see how we get through this week and then see any questions you have. And we're happy to do, one-on-one chats through the phone as well. Benefits are effective 10/1 as always. There are some changes with the medical plan this year. The medical plan changes. You are staying with Highmark, but some of the plan options have changed a little bit. So that means some of your benefits have changed a little. So I will spend more of the time or most of the time going through that today. Dental plan, there is a change in provider. So you're moving from Highmark to Emeritus, different provider. We'll get to that as well. No change in benefits. There's actually a little bit of a couple enhancements to the benefits. Vision plan status quo stays as is, and you're staying with Highmark. Our goal is always to just educate you on your health plan options, what is best for you, what are the changes, and how best to use the plans. Because what we know is there's no good plan or bad plan, and I know we always like to say this plan's better, this plan's worse because it has a higher or lower deductible or higher cost, lower cost, what have you. All the plans cover the same things. It's really just educating you about the plan design and what's best for you this year, for you as an employee alone, for you and your family, you and your spouse, what have you. So we'll go through that. And that's where sometimes after this presentation is where you might have a one-on-one conversation with one of us on the team to really drill down on what your questions are and what you're thinking for you and your family. Okay. So don't feel like everything has to be answered right during this call. Happy to pull aside separately with you as well. Benefits platform we call Quantum Ease. Instructions were sent out, but we're going to review the instructions again about how to load back on because last year was our first year working with you and we introduced the benefits enrollment platform. And we know some of you probably haven't touched it since, and that's fine. So we'll reintroduce you to it and how to get back on. Okay. And some of those communications were coming out last week, and we're going to reiterate as well. You'll see a few more communications coming out from our team reminding you about enrolling. Okay. So I'm going to scroll here, and yes, here's the small one that I'm going to increase. Okay. So I'm going to bring this up a little bit larger. And you're not going to be able to see the whole page, but there's a reason for that. I want to go through each plan with you, okay? What you have here is what you're used to, your current plan 1, what you're on now, and then the renewal plan, what it's actually going to be. And we did that for your 3 plans, what you currently have. So this way you can look at what you have now because we know you're all of you are on different plans. Some have 1, 2, or 3. That's how we've labeled them. Anything in yellow, highlighted in yellow on this renewal plan, whether it's 1, 2, or 3, is what has changed, is what is different this year. So I'm going to go through that with you. Then you will see what the monthly costs are, and you will see what your weekly contributions and what the changes year from last year to this year, okay? I will say that Miller Brothers, they did a great job. We had a lot of negotiations with Highmark and another carrier to really try to get your rates down, to look at different plan options for you this year. Highmark really did cooperate in coming back and getting their rates down. So a lot of back and forth, but I do think we're pretty pleased with what it did come out with this year. But let me just try to show you what the actual changes are and where that may impact you. Okay, so right here, if you're going from if you were on the plan, a lot of people called it the 1,000 plan. That was a $1,000 deductible plan. It has gone up. It's now the 2,000. So you used to be on a 1,000, 2,000. You're now on a 2,000, 4,000 individual family deductible. So yes, that did go up. Your primary specialist copay, 25 stays the same for primary. Your specialist actually went down from 50 down to 25. So that's, there's some trade-offs as we know. As benefits change and trying to bring costs down, some things go up, some things go down a little, okay? Everything else other than that, inpatient hospital, outpatient, x-ray, same as you've had before, 0 after you meet your deductible. But now if you're an individual, you have to meet 2,000, not 1,000. If you're a family, you have to meet 4,000, not 2,000 before these benefits here go to 0. Okay, and hopefully you can see the little hand here as I sort of go through each benefit. The ER stays the same, 150 after deductible. Your urgent care went down. So now instead of 75, it's now $50 after deductible. Your total out-of-pocket max. This is probably the hardest thing for me to explain because I had a question Highmark on this. I know everyone's going to ask it. Why did it go from 7,900, 15,800, which was so high on your last plan, down to 2,500, 5, which is very attractive. Now your total out-of-pocket max, really for an individual, your deductible is 2,000, but your total out-of-pocket is 2,500. For a family, it's 4,000 deductible, but total out of pocket is 5. Whereas before, you had to hit a higher deductible before all your, a higher out of pocket max before all of your costs would go to 0 for the year. Now it's lowered on this plan. Highmark couldn't give me any rationale as to why. They design their plans the way they want them. But this is more attractive on this plan that you don't have to go to as high of an out of pocket before all expenses would be paid. So this is very attractive. What they also realized, Highmark told me, was that not many people ever hit the 79 or 15.8. On this plan, not many people did. On this plan, they felt that it was worth it for them to lower their risk. So really the risk is on Highmark. So if you have, you hit 2,000 or 25 and your costs go to 0, Highmark's paying the rest of the cost. They're willing to take it. So bottom line is, if how you translate that is, it's a plus in lowering the out-of-pocket max for you. Why so low? Can't explain it. Highmark does what they want with the plans that they want. That's pretty much the easiest way to explain it. I could have thrown another plan in here that would have had the same out-of-pocket max that you had last year. So this was definitely a plus as well, that we could get a plan that was a little lower for you, for your total exposure, if you ever would have hit that. Lifetime maximum stays the same. Out of network, that went down a little bit. So from 5 to 10, 4 to 8. You actually now are 80% after deductible for out of network coinsurance. Previous plan was 70%, so this is better, 80%. They're going to pay more if you go out of network. Out of pocket limit, they didn't have one on this plan. Don't know why, but they just decided they did not need one on this plan because it's rare that people go out of network with this coverage. So that was their rationale there. Here's probably your biggest change with the integration with the deductible. Your prior plan, you had no, your RX, your pharmacy, was not applied to deductible. If you went and had your prescription filled, whether it was a low-cost generic, brand, non-formulary, or you did mail order, this is what you paid. Now on this plan, you're going to pay whatever the cost of that pharmacy drug is until you hit 2,000 if you're an individual, 4,000 family. Then it goes to 0. So this is where if you were on a prescription drug, it doesn't matter low cost or high cost, is where you might feel it a little bit and say, well, why am I not just paying $4 when I go to get my antibiotic or whatever it is? I'm now paying 25. I'm just throwing some numbers out there. That's because you're going to pay the full cost of whatever that prescription drug is until you hit your deductible, 2,000, if I'm just going with the individual here, then it goes to 0. So for someone who is paying a little more for pharmacy, you're not going to pay just what that specialty drug is. You're going to pay the full cost, but then that cost is applied to your deductible. So you may very well hit your deductible earlier and then go to 0. So again, this is where, and if you have questions, I can specifically, like if you're on a specific drug that is high cost, I can do like a one-on-one with you and sort of try to estimate some things for you. Probably better we handle that one-on-one, but I just want to let you know that if you're going to feel anything on this change in this plan, is probably on the RX. The others is probably you're not even going to feel a difference. You're going to like that your specialist went down. You're going to like your urgent care went down, just the RX. And that depends on whether you take anything, how often, etc. Let's look at the cost here. You were at 443. I'm just going to reference the employee only, but you can see all of them. We did go up a little bit. So even with the plan changes and all these, ups and downs, we did go up a little bit in overall cost, and we did go up a little bit when your EE means employee, weekly contribution is. Not bad, much of an increase. Okay, I do know it's an increase. It's always hard to say it's an increase, I have to be honest, but very little change this year, and a lot of negotiations to get you to this point. So I'm going to move on to plan 2. Keep going. Please, like I said, interject any questions you have. If you were on plan 2 before, it was your 2,000 plan. You called it the 2,000 plan. Now it's the 3,200 plan. So yes, that deductible went up as well. Whereas before you had $30 or $50 copay for primary and specialist after you hit the deductible, this one's 0. So before you had to hit 2,000, then you'd have a $30, $50 copay after that. Now it's once you hit your 3,200, zero after deductible. Okay. So there's no copay after deductible, but yes, your deductible did go up from 2,400 to 3,200, 6,400. Okay. Everything else with hospitalization stays the same, zero after deductible. Your ER is zero after deductible, so you no longer have a 150 copay after that, and you'll no longer have a 75 copay. So they really made this a truly everything applied to deductible: primary, specialist, hospitalization, ER, urgent care. So you will pay the full price of whatever those visits are. Primary care, you go for like an ear infection, whatever that visit is. If it's $50, 100, 120, you're going to pay it. You're no longer going to pay that $30 copay that you had before. But if you only go once a year, that's it. Everything applies to the 3,200, then it goes to zero. Okay, so this is really called like your true high deductible health plan where everything applies to it. Okay, once again, your total out of pocket max went down. Always have unlimited lifetime max. All the plans have that across all carriers. Your out of network went up a little bit from 510s to 6,400, 12.8. You do have a little bit better and higher co-insurance, 80% from the 70 before. Integrate it with deductible, same thing. So that anyone who is on the plan 2000 now and goes to the 3,200, the same change here as your 1000 plan was, just as I explained before. Anything you spend is paid out of pocket for your pharmacy, applies to your deductible before it goes to zero. So again, on this plan, where you'll probably feel or see the major difference is a pharmacy. And then, yes, it is a little bit higher deductible as well. And you're not going to be paying anything after you hit it. So you're not going to have a copay after you hit it. It's just going to be zero. Okay. Here's where we were able to get the rates to go down a little bit. You used to be at $417. Now the monthly cost is $404 for this plan, employee only. And again, I'm just going to reference employee only because I know you can see the others. And then with the weekly contribution went down from 80 to 77. Okay. That's the major changes there. And again, happy to address anyone specifically. If you feel you're looking at this year and you used to be on the 1000 plan and maybe you're now going to go to the 2, but maybe you're on the 2 last year and you think you should go to the, or I'm sorry, you were on the 2000 plan last year and you think you should now flip to the 2000 this year. So I know it's like a lot of choices. I think you're going to see people flipping this year. Whoever had the 1000 might, you're going to either go to the 2000, but some of the people who are on the 2000 now may be on the plan 1 instead. So look across your current plans, see where you're at, and then we can definitely address individual questions as well as to where you feel better being at this year. I think we're going to see some more shifts. The only plan that really didn't change at all, not at all too much, is your 5500 plan. So this is your PPO Blue Healthy Savings 5500. So no change. And again, let me just reference that preventative care on all these plans is covered 100%. So you go for your yearly physical, your yearly blood work, mammogram, if it's a preventive colonoscopy, these are all covered 100%. Remember, all of these, when we start talking about copays, coinsurance, doctor's appointments, this is for, you have an ache or pain, you hurt your leg, something like that, not preventative is when the costs start, okay? This plan, again, zero after deductible. Yes, it's a higher deductible, 5,500. Nothing changed with out of pocket max and deductible, everything the same. The only thing here, I will say the total out of pocket maximum, that is the only thing that changed. It went from $67.50, 13.5 to $69, 13.8. Not a big jump, but it did go up a little bit. In addition to the out of network, 510 went to 55.11. Again, they're the only two changes. You're still 70% after deductible. And then nothing changed here with your prescription. It was always included in deductible. So whereas the first two weren't, this plan, if you're on this plan before, it's not going to be any change to you. The RX was always included in the deductible, and you always had a copay after deductible. Okay. So you went from $318.43 to $347, 61 weekly contribution to 68. Looking at this plan, this is also where a few of the people who are on the 5500 plan might actually want to consider the 3200 plan this year, because the 3200 is now a true high deductible and it's not really that much more than the 5500 in cost. You might want to consider coming off the 5500 and going to the 32. Just a suggestion, but looking now at how your plans are laid out, where you stand with deductibles that are all a little bit higher, some of those on the 5500 why you want to consider coming over onto the 32. And again, we can talk to you individually about where the benefits would be and where you'd see some changes, but you're already used to the pharmacy being included. You're going to get an advantage of not 25 after deductible, but zero. And you're used to all the same zero after deductible that a lot of these plans, the 3200 is as well. So I think a lot more choices this year. You're going to really have to look at your plans and decide which one's best for you. You might be shifting across the plans a little bit, and we can help work on that individually. I'm just going to pause here. I know it's a lot of information. I wanted to at least explain the differences. Make sure you see it across. You'll have time to then, absorb it, get off the phone, and then reach out to us with questions. But anyone have any questions right off the bat, anything that stands out to them? Okay, I'll keep moving along. Okay, we're now going to go to the dental. And I'm just going to decrease this a little bit just so we have a little more. Okay, there we go. So this year what we did was we moved from Highmark and you're going to Emeritus. Yes, it is a different dental provider. You'll see that everything stays the same with the exception of one benefit that's actually a nicer benefit. You still have the deductible of 25 individual. Family is 3 times the deductible, which means 150, 3 times 25. Preventative, yes, deductibles waived. You still have the calendar year max. I don't have to go through all of this with you. Like as far as benefits, status quo. Your rates decrease. I'm going to hit that right now. So your employee, spouse, children, family, all decrease. So your weekly contribution, everything's going to go down. Let me explain this 80, 90, 100%, 80%. So where with Highmark, you had basic coverage like fillings. Okay, filling is a basic coverage, would have been covered at 80%. Emeritus is now saying, well, we're going to cover it at 80% year one when you have your appointment. If you come back to us next year and you just have one yearly appointment with us, that you're doing all of your preventative work, you may not have now another filling in year 2, but you came back to us. Now, say year 3, you come back to us again. So you're just doing your yearly, once a year, every 6 months, your dental appointment that you should be doing. If you get a filling after year 1 and say it's year 3, they're actually going to cover it 100%. So what this is called with Emeritus is incentive. It's as long as you have at least one dental claim submitted each benefit period, they continue to advance on the coinsurance. So just go to the dentist every 6 months or once a year, because when something happens that falls into that basic category, it shows that you went, and then they will start to increase it year over year, 90%, 100%. That's a big deal to get some of these things covered 100% in network. 80%, you're always going to be paying 20% of whatever that bill is, of whatever that charge is. So all you need to do is just keep going, even if it's for your preventative cleanings, because if year 2, year 3, something happens, even year 4, year 5, they see that you've been going consistently and they'll increase that coinsurance for you, which is a nice little plus. A little hard to explain, but it's a nice little thing to have there with Emeritus. Another thing Emeritus offers, they include what's called their Fusion Vision. You can get up to $100 from your dental maximum. So the maximum's at $1,000, but up to $100 toward any cover eye care expense. Now you already have a vision plan. We know that. We're going to go to it next. But I just want you to know this is a nice little benefit that Emeritus provides, that if you haven't used all of your 1,000 maximum, which a lot of times people don't in 1 year, you can actually use $100 from your Emeritus plan towards your vision. And it's usually just an eye care. It's just, usually an eye exam. So again, a nice little plus that some of these dental plans have been adding on. Maximum allowable, I will just explain that briefly. It means the reimbursement for services provided by an out-of-network dentist is capped at the maximum allowed for the in-network service. So what may happen is some of you are going to be on a dentist who is covered by Highmark, right? That's what you're used to. You're now going to go over to Emeritus. We put the provider lookup here, okay? Because we really want you to go online and look up and make sure. While we can't say that your dentist is going to be covered under the Emeritus network, it's a 90-95% chance they are. There is a possibility some of you will say my dentist isn't in the Emeritus network. So then you have to consider whether you want to stay with Emeritus, go with Emeritus and go to your dentist who's out of network, because then you have to pay the out of network percentages, which again are not that bad, but I just want you to be aware of that. Or whether you might then not choose the dental this year because your provider, you don't want to change providers, and that provider is not in the in the Emeritus network that you currently go to. So I do highly suggest you look up your provider now before you enroll. Call your provider and ask if they are contracted with Emeritus. They should know, but that may dictate some of your decisions this year. Again, we're taking the chance because we really need to, I think, move you in the dental this year and get you to a lower rate. And we were able to achieve that. They have a very high network of growing providers. I can't say, though, it's a one-to-one match. I can't say that every provider who is covered under Highmark will be in Emeritus or vice versa. If you are out of network, though, do see that the preventative is still covered 100%. Basic is at 80, major at 50. So I just want you to be aware of that. But let me explain just why I mentioned the MAC, because if you're out of network, you stay with your same dentist, they're not with Emeritus, but you have the Emeritus plan. If you're out of network, that dentist has to cap the maximum allowable charge for you at the in-network service rate. So all that means is you may have gone out of network, but they can't charge you any more than what the in-network highest service charge is. Okay, so there is a cap. They're not going to go extreme out the door wazoo with too high of a charge for you. I just wanted you to be aware of what that maximum allowable charge means for an out-of-network dentist. They can't charge just anything. They have to do the maximum allowed in-network charge. Okay, so I know it's a hard one to explain as well. I'm happy to explain it individually, but I just want you to be aware of what that meant. Reminder, this is a voluntary plan, all employee paid, and it's about a 3% decrease over the rates from last year, so you will enjoy a decrease there. If you need help looking up providers in the network or calling Emeritus, please let us know as well. We can help you do that. Vision stays the same. You're currently with Highmark. You're going to renew with Highmark. It's the Davis Vision Network. Stays that way. Nothing's changed. There is a slight increase in cost here. It's about a 2.7% increase from the rates of last year. You can see them here. So 488 to 502. So if you were contributing $1.13 weekly, it's now $1.16. So it went up a little bit across all coverages. Not high, but again, do want to show you that and let you see that there. No change in any benefits. For the enrollment, Quantum Ease, we call it Quantum Ease. It's our enrollment tool. This has been put out in the communications. I know that Miller Brothers, yourself, you have sent out communications we have from our enrollment platform. You may not be used to it, so you may not, have seen all the communications, but the link is here. This is also on our benefits enrollment platform, and I believe you have a copy of this that was sent out as well through email. We understand some of you you'll remember your username and password and you'll enter it, and that's great. Some of you won't, no problem. You're going to select forget password, and you're going to click the button under employees, and you're going to be able to reset it. Some of you are going to forget your username. We're going to ask you to submit a request to the Quantum Benefits team. They're going to reset the email for you. I do have two contacts here, but instead of everyone going to Lily and Allie, which you're happy, you can do, I also want you to know that we have a service center set up for you. And you can just copy this link or click on it in this document. It'll take you right to the Miller Brothers Service Center support. In the upper right-hand corner, you hit submit, and then you can submit a request, and then it goes to all 4 team members, and then we troubleshoot, and whoever's got the time is going to take your request and respond to you. And if you need a call or pick up the phone, I'm going to call you. So instead of, I think, going straight to each person, what I'm going to suggest you do is hit this, link here and submit to the service center, because then 4 of us can troubleshoot. And if one of us is not available for a few hours, you're not left with not getting an answer. That's why we like to use the portal as much as we call it. We call it the Service Center portal. So if you've not registered yet, you're new to Miller Brothers, or you're choosing insurance with Miller Brothers and you never chose it before, but now you are. Maybe you're going off a spouse's insurance and you're going to choose Miller Brothers. You're going to select register as a new user. So after you come in, you'll also be able to select register once you hit the main link. You're going to enter this information below. It's going to ask for a company identifier. That's the last 4 numbers of your social, and then your birth date. This company identifier is MBSS. Once you're in the platform, and of course this is just a mock here, you'll say good afternoon in your name, and it's going to tell you have 1 item to complete, and hit start enrollment. Once you start the enrollment, it's going to take you to your next step, which is some of your personal information. You can update your telephone number, what have you. Then you're going to go click get started, and you're going to be able to enroll in your medical, dental, and vision. It's going to show you what you have now, and then show you the 3 plans, and you can select it, and it's also going to show you your per pay amount. So I think what I show you here was also your per pay amount. So what you'll see in the tool will also be your per pay amount. So you'll be able to relate to it as to what's coming out of my pay each week. Okay, and this is just an example here. It'll say open enrollment, let's get rocking, get started, and it's going to plug you through each page. And that's really it. We love technology, but we know with technology there can always be quirks. So if you can't advance, if you can't get into the tool, again, submit a request over here. You also have Lily and Allie's name here, but get to one of us, submit a request. We know things happen. We can clear it up behind the scenes for you and get you in. If for some reason you just can't get in, we'll be happy to do a call with you, and we'll enter your enrollment options for you, and then we send you a screen print back. So just to make sure you have something back that we submit it for you, that you see what it is, and it shows all your coverages, weekly rates, total for the, total coming out of your pay for all the coverages. And then you have something that you can look back on that agreed as of this week. This is what we submitted for you. That's really it. So major changes, I wouldn't say major because a lot of the plans are similar, but your medical is where you're going to see the change in benefit design this year. I do think it was a good choice of where we got you to keep your rates at a certain point, but also keep your benefits not too different from what they were before.
Kathy, this is Nick.
Yep.
Is there a place on here that shows where they can decline coverage?
Okay.
Because everyone needs to either everybody, just so you know, you either need to fill it out and get insurance, or you have to fill it out and sign the declination.
Correct. So what will happen is when you go into the tool and you hit start enrollment, and then you go down here and you get started, the same thing's going to come up. These plans are going to show at the bottom. All it says is you either click the plan you want, or it says, I don't want this. So you hit the button that says, I don't want this. And then it's just going to say why. And you can say, too expensive. I just don't want it. I'm on my spouse's plan. You just click one of those, not interested, whatever. And then you go to the next plan. But you will have to do that for each one, medical, dental, and vision. You will have to go in and say, I don't want this. I'm waiving it. 1, 2, 3, get to the end, hit submit, and then we get your submission of that you waived. Good point, Nick. And the reason we're asking you to do that is because, and I know if you always waive Miller Brothers Insurance, this is probably a pain for you to do it, but this is your once a year chance to enroll in health insurance offered by Miller Brothers. We want to make sure you know it, you're aware of it, and we didn't just waive you because you didn't tell us, or there is a change this year and you're like, whoa, I do want the dental. I don't want medical or vision. I never take it, but this year I do want the dental, and we're going to go off my spouse's and we're going to go on mine. So we don't ever want you to miss that opportunity to know what Miller Brothers provides you, because 3 months later you won't be able to enroll, and we don't want you to say, well, we had no idea. We didn't know dental decreased and you went to a different provider. We didn't know you changed the plans and now they look different, and this is something that's more attractive than my spouse's plans and we want to go on Miller Brothers. And so you just need to be informed, and if we click for you, then it sort of takes you right away as that once a year benefits enrollment. And we just don't want you to come back and go, oh my gosh, we had no idea. So we need you to go in. If you waive, you waive. I will say this though, if we don't hear from you by the end of this week, nothing, and you waived it before, we are going to send out a communication that says, okay, we tried. we tried, we sort of beat you over the head. If you waived before, we're going to waive you again. Like we've done enough. We've communicated enough. If you waived before, we're going to waive for you, but just know this. And if you enrolled before, we're going to enroll you in the closest coverage that you had. Because at the same time, we can't assume that you don't want. If you've enrolled before and you didn't respond and enroll and just assume someone was going to enroll for you, well, we're going to contact you, of course, at least 3 times. And then if not, we're going to say, okay, hello, but we're enrolling you in the most similar level coverage of the plan for you for this next year. And this is your last opportunity to say yay or nay. So we need you to go in. We need you to enroll or waive. We will have a cutoff point where we'll then say, okay, we've said enough, we've done enough, we have to make some assumptions. And if you waive before, we're going to waive you. If you enroll before, we're going to enroll you in the closest level of coverage. If the plan stayed the same, a lot of people don't worry about that. They go, oh, just enroll me in the same plan. But they didn't stay the same. And that's why we don't want to do that. We're leery to do that. We want you to look at the plans with medical. We want you to make the choice of what's best for you and talk it over with us. Okay, so this year, I think you're going to look it over a little more. But I just want to give you the rationales to where we are. Like we have to move at a certain point after we've communicated and followed up with you via email and phone. Okay. But thank you. Yes, about the point of waiving. Everyone forgets you do have to go in and waive because it is your right. We want you to know it's available. Okay. And don't forget this link here. It's important. Definitely you'll get 4 people versus just hitting the 2 here. And then if you need a call, we'll schedule a time to talk with you. If we find by the end of the week not everyone's enrolled and we get any communications from, like Casey or anyone that says, hey, we need some more time, we'll open it up a little bit longer. Just know that the quicker we get this done, the quicker we get the enrollments over to Highmark and Emeritus, and then The quicker ID cards are to you by the first or the first week in October. Given the plan changes, yes, you will have new medical ID cards. The numbers probably will change as well. I don't have confirmation on that yet. So if anyone has an appointment in the first week of October, because it will be a different plan, I'd like you to just email us or put your request in the portal. We will get you your ID high mark as soon as we can. We'll send it to you via email. We'll get the ID number, etc., and send it over to you so you can get it to your doctor. You may not have the card, but we'll get you your ID number. Okay, so definitely want to let you know, like, if anyone that 1st to 5th of October, please let us know. I don't want you stuck at the doctor's office and they tell you they're not recognizing your plan ID, and I don't want you to have to reschedule if it's something you've had on your calendar for a long time. I know it's hard getting in today. Okay. If anyone needs this information sent to them directly, please submit a request to the portal. We'll get this out to you as well.
All right. Thank you very much.
Thank you. Yes, everyone, and have a good day and look forward to some more questions via our portal.
Okay. Thanks.
Take it
Bye.
easy.
Thank you.
Thank you.
Thank you.
Bye-bye.